For the record, my name is Jonathan Jones. It's my pleasure, my privilege to be your host and moderator for this afternoon's discussion. As you can see from our opening screen, the month of June has been declared to be National Cancer Survivors Month. And so we take advantage of the fact that, there's a calendar that seems to roll on a bunch of different topics that folks are having a particular awareness about, or that there's a spotlight being placed on for that particular month. And we try to use that so that we can in turn cast a different light on it. We're not talking about just the fact that these diseases exist or the fact that there's more attention needs to be given to it. We're not going out and marching. We're not walking. We're not doing fundraisers. We're informing. We're informing people that there's something that can be done. And the something that can be done is one of two things: continue to be part of the statistic, or defy the statistic. Take charge of your own health and well-being. And we really would like to give people the option to take charge of their health and well-being and to do something about it, to avoid just sticking with the status quo. This particular statistic is not going to be mentioned in our slide presentation for today, but the National Institute of Health has mentioned that all-cause mortality is higher, particularly since 2021, which means that all causes of death have gone up. And that's depressing, but it should be sobering at the same time. And I say sobering in the sense that it should give us cause for pause and make us think. Is it better for me to take action sooner rather than later, or should I just wait and see what happens? Should I wait and see what happens? The people who have health problems, it's always someone else. I encourage you, don't wait until it strikes close to home. Because the truth of the matter is, and this is my personal opinion, there's only two kinds of people in the world: those who are sick and those who don't know that they're sick yet. So take action, because we fall into one of those two categories. And again, that's my personal opinion. But again, my name is Jonathan Jones. I deem it to be a privilege and a pleasure to be host and moderator for this program a few times a month on Sundays. Mainly because it gives me a chance to talk to you and to pass on what little bit of information that I know. I'm not a doctor, and I'm a researcher, and I'm an educator, and I'm a practitioner. So I spend a lot of time trying to help people figure out what to do, and so that they can take action steps about their own health and well-being. And I'm happy to say that I've seen thousands of people turn their lives around, thousands. And I'm very happy to say that. And I'm even happier to be in a position to at least pass on information and connect you to someone like a Dr. Prasad, who is infinitely more qualified than I am to speak on subjects like this. So I'm just going to do some of the groundkeeping work and lay the foundation for the discussion, some of the basic statistic information. I'll pass that on to you real quick, and then we're going to hear what Dr. Prasad would like to share with us. So the screen you're looking at right now, again, is our introductory screen, but the law requires that we make sure that you understand a couple of things, and this is what we'll share with you right now. So you can read along there, but the FDA has not evaluated the statements that are being made. Testimonials are anecdotal. Results are atypical. And that means that what happens to one person may or may not happen to you. And the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, nor any of the hosts, co-hosts, or authorized representatives are making claims that any supplements recommended will treat or cure any disease state. This presentation is for information and educational purposes only. It is not intended to be a substitute for a visit to your doctor. We recommend that you seek the competent medical advice of professionals that you trust. And we say that not because you should be cautious or fearful of what's being shared with you, because I can guarantee you that the information has been researched and that the source that you're getting it from, especially Dr. Prasad, is eminently qualified, and I'll give you his credentials in just a couple of moments. But this is a fact. Over 2 million new cancer cases are expected to be diagnosed in the United States this year. 2025. 2 million new cases. And remember, all-cause mortality is on the rise. So this figure here is higher by 10 to 20% than it is expected to be. So more people are coming down with this dreaded condition than ever before. It is projected that 1,700 people will die every single day this year from this dreaded condition. That's a lot of people. That's every other day a 9/11 taking place. And they don't talk about it on the news. And I think that that's just tragic. I just think it's horrible. The most common types of cancer in women is breast cancer, followed quickly by lung cancer, and followed right on the heels of colorectal cancer. Now, the type of cancer in men that's most common is exactly the same, except that the top one is prostate cancer. And you notice that in both cases, 30% of the cancer cases in men is prostate, 32 of the cancer cases in women was breast cancer. And then it comes down into the low double digits or single digits for the other two types of cancer, the most common types of cancer in men and women. So we hear about this a lot. And so we really should be paying careful attention to, is there something I can do to fall into the category? Because we're going to tell you a little bit about how people are surviving, how people are thriving, and maybe even share with you some of what they're doing. Before we get there, I want to show you this one particular slide right here. This is the one I want to spotlight for you, because I think this is one action step that you or I can take to take charge of our particular health situation. Because 42%, more than 40% of cancer cases can be prevented. That's according to the American Cancer Society. 42% of all cancers can be prevented. The top one cause of preventable cancer is smoking, followed by obesity. And I don't know about you, unless you've been hearing some of these presentations that we're here on this program on the weekends. But you don't hear a whole lot about how obesity is connected to cancer. We don't hear much about that. Dr. Prasad has talked about it, and I'd love to hear some of his insight on it. But obesity is the second leading cause, preventable cause of cancer. Obesity. Why don't we take that more seriously? Alcohol. I dare you to try to stop people from getting access to alcohol. But here's where I really want to take this. Is number 4 on the list is UV radiation. And by the way, every single item on this list, Dr. Prasad has a formula that has addressed it in one way or another. So that's why you're really in the right place right now. Okay, so if 42% of all cancers is preventable, forget surviving it, how about not getting it to begin with? So that's what drives me personally. Because everything that this man has formulated, I have it sitting on my desk right in front of me, and I have it by my night table, and I have it by my easy chair. Yes, I do sit in an easy chair. I keep telling you guys to change your relationship with your couch, but I do have an easy chair. There are some times when I will sit down and I'll actually watch television and do nothing. So everybody should do that. You need to have some downtime. Everyone should have that. But I have Dr. Prasad's formulas everywhere because I don't want to get this condition. I would encourage you to do that. But please take note here, UV radiation is number 4. Physical inactivity, number 5. Poor diet is number 6 on the list. Number 2, number 4, number 5, number 6, all things that you can do. And I really want you to just pay careful attention when we talk to Dr. Prasad when it comes to this. This matter of UV radiation, the World Health Organization has placed cell phones into the category of possible carcinogens, just like cigarettes. Can you imagine that? The number 1 form of cancer in children these days, I gotta see if that's still a current one, but the last time I checked the statistics it used to be leukemia years ago. Number 1 form of cancer in children used to be leukemia. Last time I checked, it was glioblastoma, brain cancer. So you should be asking yourself a question: how and why would children be now getting brain cancer? And I'm not going to try to answer that question, nor am I trying to lead you to draw conclusions. However, could it be that there's a higher exposure to devices that the World Health Organization says is a possible carcinogen? It's very possible, isn't it? The top 5 treatments for cancer is still unchanged. The number 5 is the newest kid on the block, so to speak, is immunotherapy. But surgery, chemo, radiation, and targeted therapy, those have been around for a minute. Actually, number 4 and number 5 are the newest ones. But immunotherapy is where they take DNA from the cancer and they create a specific regimen that's targeted, that's designed to go after that cell and that cell only. And Dr. Prasad has said that that's been more successful and has proven to be less problematic. However, just 3 weeks ago, had a case with a client who called up and she has vitiligo. And she did not have vitiligo before she got cancer. She never had any skin problem before she got cancer. And even while being treated for cancer, she didn't have it until immunotherapy started. And somehow or another, the target DNA was closely in line with her skin. And so now her immune system is destroying the pigment in her skin. So she's very concerned about that and was looking for something else that she might be able to do. That's not a good thing to have, by the way. But let's talk about cancer survivors a little bit. These are the last statistics that I was able to pull up on the matter of surviving and recurrence, the risk of recurrence. Currently, there's more than 18 million people living with cancer in the United States, and it's expected to reach 26 million by the year 2040. So the rate of survival is expected to increase. In fact, the 5-year survivor count you see is up by 53%. That's since 2022. So people who survive cancer for more than 5 years, that rate has increased. Recurrence risk varies by cancer type and stage. So depending on the type of cancer and the stage of cancer, that will determine what the risk is. I'm going to show you that in just a moment. But common triggers, look at that. Immune suppression, oxidative stress, low glutathione. And I would encourage you folks, if you haven't heard a single word I've said up until right now, I write down what you see in that 4th bullet point right there, because this has Dr. Prasad written all over it. So the common triggers for recurrence: immune suppression, oxidative stress, and low glutathione levels. That's a big deal. And Dr. Prasad talks about that over and over and over again. Those are the things he's talked about. The cancers with the highest risk: glioblastoma, ovarian cancer, bladder, liver, and colorectal cancers. Those are the ones with the highest rate of recurrence. Prevention insights and lifestyle support. These are all very interesting things. I love bullet point number 2 once again. Antioxidants and glutathione and gut health. You might as well just slap Dr. Prasad's picture right there. The other things are important too, don't get me wrong, but the number 2 most important things, if a person is going to take an action step to prevent, is antioxidants, glutathione, and gut health. And we'll hear more from Dr. Prasad on that. And of course, the 4th bullet point: support immune function to fight recurrence proactively. So those are the latest statistics. Those are facts. You can go look these all up yourself and see and confirm them for yourself. And again, this is recorded, so you have access to the information again if you want to go back and fact check it. But I'd like to now introduce to you Dr. Prasad, and let's get some insights from Dr. Prasad when it comes to surviving cancer. Dr. Prasad's accolades are right there in front of you. You can just take a look and see for yourself that he's been around the block a few times. He was the professor at the University of Colorado School of Medicine for more than 30 years. He was invited to be a member of the Nobel Peace Prize nominating committee for candidates in medicine. And he's authored or co-authored 33 books is what it says here, but I think he's up to like 36 now. Dr. Prasad is 90 years old, and he's still writing books and publishing papers. And his micronutrient formula, microdaily EMF, was just recently awarded a U.S. patent. No longer patent pending. It was just awarded a patent. So this man is still cranking out unique stuff at the ripe young age of 90. He's been published in peer-reviewed publications more than 250 times, and there's more than 450 references to Dr. Prasad's works in PubMed. And to put that in perspective, there's not one reference to anything I've ever done in PubMed. I know we don't even belong in the same sentence. I know. That I was just being facetious and trying to see if you guys are awake. Is really what that statement was all about. But Dr. Prasad is absolutely phenomenal and amazing when it comes to this. So I'm going to just stop John right now, and let's see if we can't take a minute and hear from Dr. Prasad. Let Dr. Prasad give us some insights when it comes to surviving cancer, beating cancer, and correct me on some of the statistics that we just talked about. So Dr. Prasad, thank you very much again, sir, for joining us in this discussion.
Thank you, Jonathan. As I always enjoy being with you and engaged family members. And thanks for coming and participating in these important issues.
Now, we're thrilled when you're willing to come. So we're excited. So please go ahead.
No, the cancer prevention is a different issue for normal people that we can discuss some other time because it's much more complex. But here we are discussing today, and if I have time, we can discuss other two. The cancer survivor. And you very nicely mentioned the risk of reoccurrence of the primary tumor that you have. And there, like you mentioned, there are very high risk, many people develop. But they also develop another completely new primary tumor induced by treatment agent, especially chemotherapy and radiation therapy, those people who have received this. Brand new type of cancer, which is distant. Suppose if you have a cancer of the stomach, but you develop cancer of the lung, which has nothing to do. They were not exposed to radiation. So it is away from the site of radiation developed. Why? Because when the cell dies, cancer cell dies, they release a lot of toxic chemicals. And then they migrate and damages normal tissue way away from the site of radiation.
Wow.
So you develop a new cancer and so there is a lot of incidence of that as well.
I've never heard that before, Dr. Prasad. I'm sorry to interrupt you, but I never heard that it was the toxic cancer cell that can cause a recurrence of a different type of cancer. I did not know that. Thank you.
Right, yeah, because they produce a pro-inflammatory cytokine which migrates and damages all kind of cell, and happens to be some cells are more sensitive than the other. And so it is well known in radiation biology study that this is true. And also clinically it has been shown to be true. Not only that, cancer, there are some also non-cancer disease occurs as a consequence of radiation chemotherapy, and that include a lesion, for example, non-dividing cell get damaged like brain neuron or muscle cell, that they are not dividing, because cancer cell can arise only from those cells which are dividing or which have potential to divide. But muscle cells don't divide. When they mature, they're there. So they develop a strong lesions, and they are difficult to heal. And so there is another non-neoplastic or non-cancer disease occurs as a consequence of radiation chemotherapy. So survival faces a lot of issues as a late effect. Even during the time, they have poor quality of life. They have brain fog, the tiredness, fatigue, and all these kind of things. So the question is how you take the advantage of the best of the both worlds. And that's why our approach has been that how we can reduce the incidence of primary cancer, second primary cancer, and non-neoplastic diseases. And as you know, Jonathan, all these processes, increased oxidative stress plays a central role, and chronic inflammation plays a central role in initiation and progression of this cancer, and even in its acute side effects. And so, and so I think this is very important to remember. And our prevention formula that we have, for example, Core 4, is extremely valuable for reducing the risk of cancer among survivors.
Mm-hmm.
This is, and the treatment is different issue, as you know. I'm
Right.
talking just the survivors.
Right.
And
Mm-hmm.
and the cancer cells really, for example, this is easy, the reoccurrence of the primary tumor because some few cells left, and then after they reappear, 10 years later on. So
Right.
that is easy to explain. But new cancer is totally different issue.
Mm-hmm.
There, all these damage that the dead cancer cell releases toxic chemical, and they affect those kind of cells, and they cause mutation. And as you know, mutation can occur in oncogene. That means the gene cancer causing is activated, and then the cell become cancerous. Or mutation can occur in a tumor suppressor gene because our
Mm-hmm.
normal cell have both, but the oncogene is suppressed, and cancer cell is tumor suppressor gene is dominates it, and so it is very important. So in this case, they cause the cancer. Then third one, which that I proposed long time ago, is called differentiating cells, because normal cell divide, differentiate, and die. It is continuous process like a skin cell. Dividing all dividing cell grow from the original precursor cell. They grow, divide several times, then differentiate and die. This is the normal pattern. But when that pattern is disturbed by mutation, now the differentiating gene get altered, cell cannot differentiate. So they keep dividing and dividing and become cancerous. So there are three steps, and all the three steps can be prevented by our proposed idea that we are suggesting it, reducing oxidative stress and inflammation. And so that's have been our central issue. It is involved in not only in cancer, many other diseases, and that's why it is for good health as well as to prevent the reoccurrence of primary tumor or developing a new primary tumor and non-cancerous diseases. It is very important, and also diet is very important.
Mm-hmm.
So, obesity, lack of physical exercise, so we always just recommend that you do all those things, reduce caffeine, reduce, because if you drink excess of coffee, they inhibit DNA repair mechanism. So if DNA get damaged, it can't repair it if you are taking too much caffeine. I mean, I take caffeine every morning, but just 1 cup, which I share with my wife, so really only half cup.
Yeah.
And so it is very, so, but the problem is that human behaviors are difficult to change.
Right.
But for example, EMF radiation, you mentioned cell phone. Cell phone emits EMF radiation, electromagnetic radiation, which is like UV light, is a non-ionizing radiation. But recent data suggest that it not only causes acute neurological damage, but also late effect, increasing the risk of cancer, especially depending upon which area we are, increase
Hmm.
the risk of cancer. And epidemiologists studies suggested that increase, but some epidemiologists suggested no, this is not true. So somebody did, and the reason is because it's difficult to do precise. It is, amount of absorption of EMF radiation is very important. Some people get exposed more, some people less. And the epidemiology study you are doing it, some people will be less, than he would not show anything.
Yeah.
Those who get high. And so how do you answer that question? We mentioned that it is defined as a international agency for cancer have defined as a 2B carcinogen. But when they did a study in an NIH Cancer Toxicology Institute, I think it is in North Carolina, They did an animal study in a rat and found where they can control everything: distance, how much absorption is there, how much radiation is getting,
Yeah.
and what kind of frequency it is being delivered. Everything is controlled. And they saw increased incidence of varieties of cancer. And so that tells you that the epidemiology of studies is always controversial until you prove it.
Right.
But that's one way of collecting human data. But you have to be a little bit unsure what it is. But if it is confirmed by the animal study, then this is most likely true. And as you know, in the beginning, EMF radiation, it is difficult. No matter how much you say, they can't get rid of EMF radiation. Kids these days are doing all the time. So what
They're
you do?
not they're not getting rid of those cell phones.
Yeah. So what you can do, another best thing, use micronutrient, because also, just like a ionizing radiation, this EMF radiation produces a lot of free radicals. And so that causes damage. And so if you stop free radical damage, that at least reduce the risk. May not eliminate, nothing is eliminated 100%, but it will
Right.
reduce the risk. That's
Right.
what our goal is, to reduce the risk. And that's why, many people, like in this country, I think, quite significant people like, I think about 3% have a very sensitive, that they can't function. If you walk in a room, Wi-Fi always on, computer is on, they can't function it. And as you know, Dr. Coate is one of the very good example of that. Is that, and then as soon as he takes micro daily EMF, he can function very nicely. Because there is also acute effect, which we don't want to go through right now. Acute effect, neurological effect, sleeping problem, and fatigue, and all these kind of things. And you can't function, brain affected. And the mechanism is totally different than free radicals. Free radical more important for the cancer type of effect. And
Hmm.
so it is very important to remember that some of these diet and environmental, many aspects of environment, we don't have a control. And so, but you mentioned some of them we have control, but we don't follow it. Yeah, here is one example of ionizing radiations that we developed, and this study was done in collaboration with Russian Academy of Sciences and NASA in Houston, and we provided the supplement. And you can see that this rabbit was given a dose which are, if exposed to a human, they will die within 24 hours with what is called CNS syndrome, brain syndrome. Nothing you can do about it.
Wow.
But in this case, as expected, this was a rabbit, and I don't know why they used such a high dose. Those Russian Academy of Sciences did not consult me when they planned the experiment. They did on their own, except we provided the radioprotective formula. But at least you have to give them credit that they said, okay, let me see how the liver looks, because we expected they will die 100% within, I think, within 24 or 48 hours. And you can see that it was a liver, and and you can see that the those who was placebo is totally gone, dark, but this was protected, and you can see that it's very nice and tough. So at least you can see the level of protection, at least one organ with such a high dose that nobody will face it.
But
But
Dr. Prasad, this is just mind-boggling. I think that everybody should pay careful attention to the fact that these two animals, one of them was given one of your formulas,
yeah,
protected it. It was exposed
yeah,
to a
yeah,
lethal dose of radiation, and
yeah,
its internal organs
yeah.
remain fresh and intact, not subject to oxidative stress or free radical damage. That's amazing.
There can be excessive amount of free radical damage, you can imagine, because poor guy dies anything. We also tested it in a much larger animal, namely sheep, and there they be again. He used the dose what is called intestinal. Radiation has three syndrome: in bone marrow syndrome, that very easily modifiable. Intestinal syndrome, you cannot modify that. CNS, forget about it. So, so intestinal syndrome, if you get exposed to human, within 7 days they will die, and this happens to the sheep as well. they give an intestinal radiation dose, which produced intestinal syndrome. They all died it. But those who received the protection, antioxidant formulation, they live up to 31 days. Even intestinal syndrome, never in
Wow.
the history that animal receiving antioxidant, I mean the intestinal radiation syndrome dose can survive
Oh my
at all.
goodness.
But in the case of, so that tells you that antioxidant is a powerful radiation protective agent.
You said the sheep survived that lethal
Yeah,
dose?
31 days
Wow.
receiving the intestinal syndrome dose. And in animal, when we use the bone marrow dose, but bone marrow syndrome high enough that it is not intestinal radiation, but high enough to kill 100% of the animal.
Hmm.
And this we did, a study we did with the Radiobiology Research Institute in Bethesda, that is operated by Department of Defense. And we found that at the dose of bone marrow syndrome were 100% mice. You can do experiment mice here, but not higher animal. 40% of the mice survive completely.
Oh my goodness.
And so you can see that so at least for our protective we are not exposed to that kind of dose until we until you have a nuclear war. Unfortunately, I hope not. But in that case scenario, many people can be saved, and in this scenario, at least the many mice were saved.
That's pretty mind-boggling, Dr. Prasad, and it's I hope that the folks that are on will replay this and listen.
That's
Hear
why.
what you.
That's why it is very important that when you go for even from this when you go for X-ray diagnosis,
Yes.
there are some evidence, a lot of evidence, and I have uh, sent a paper for publication. The diagnostic radiation doses, like X-ray or mammogram or CT scan or any kind of even a dental office,
Yeah.
they increases the risk of cancer.
Hmm.
And so I think when I go myself for a dental X-ray, that's what I needed. Sometime I need a CT scan for my back pain, but then
Hmm.
I take my micro daily before going.
Yep. Yep. That's it. That's it. No question about it. I will not. I will never stop taking it, Dr. Prasad.
And as you know that we ran in Europe clinical study with our antioxidant combination with the CT scan, and CT scan just one produces a lot of DNA damage. And if you are taking a micro daily antioxidant, not a specific formula, but micro daily component of the micro daily EMF, uh,
Hmm.
they more than 50% was prevented. DNA damage. So there is a lot of data as far as our antioxidant is concerned. And because they all produce free radical. I mean, this is simple mechanism. It is
That's
not
right.
doesn't require a you know, extraordinary brain cell. It is just common sense.
It's just common sense. Well, I think your common sense is not as common as anyone would like to think, and we know that it's uncommon to get the kind of sense that you got. But we see your recommendation here, Dr. Prasad. Your recommendation for these cancer survivors
Yes.
is very similar to what was stated there in the research earlier.
Yeah.
Prevent the oxidative stress.
Yes.
Focus on the gut.
Yes.
And your formulas do just that, Dr. Prasad.
Yeah. Yeah.
So
And
the
with cancer
microdaily.
patient, also that, among the cancer survivor, until you are free of disease, cancer, 3 to 5 years, don't take collagen. But you can
Hmm.
take all three,
Right.
biotics, omega 3. Omega 3 does not have direct any relevance, but it is very important for your general health, brain health, heart health. So it is a good idea to take that because if anything, it will help.
Well, I can tell you about that omega-3. I am completely convinced now. But for those who are here for the first time, this is the micro daily EMF that Dr.
Yeah,
Prasad has just received a U.S. patent for.
yeah.
It is unique. There is
But
nothing else
as you
like it
know,
in the world.
yeah, it is well tested clinically. The original formula microdaily that is modified a little bit, but they have been tested in the Marine Corps in training, people returning with traumatic brain injury, normal people who have a poor health, experimentally. I did a study in collaboration with the University of in Uruguay, and because the professor was there, and I know her, and in a normal people, as you know, South American have a chain smoker, and we did, and we found that improvement in immune function, decreased oxidative stress, and inflammation both. And so I think this is well tested in human and in animal model against radiation is also well tested.
Yeah, I would say so. And I'm just trying to point out to folks who are here now, these who are thinking about survival, of the statistics that was presented there by the NIH or the American Cancer Society, wherever they came from. Glutathione was mentioned. So
Yeah,
focusing on the
glutathione,
immune
it's
system
low
support.
glutathione that is a consequences of increased oxidative stress.
Hmm.
Because if you have increased oxidative stress, your antioxidant level will go
Will
down,
go down.
and glutathione is one of them.
That's one of them. Yeah.
Yeah. So
And so we
because
got
if you want to
microdaily.
test it, if you have glutathione high level, then you don't have oxidative stress. And so
So,
this is the oxidative stress and inflammation.
mhm.
That damages the antioxidant system, means it can reduce antioxidant compound, it can reduce like glutathione level, it can also reduce antioxidant enzymes, which are very important.
Yeah, yeah, that's glutathione peroxidase.
Yeah, a glutathione peroxidase, yeah,
Hmm.
enzyme. And so peroxide dismutase, catalase, there are three very important enzymes
Hmm.
for defense.
Well, and here you are again, folks, with another statistic that was mentioned about the gut. Dr. Prasad's formula here, the probiotic boost.
Is very close to, by the way, this is also very close to get, they have been what you call put in a fast track, this formulation prebiotics. And I think within a month or two, it will get approved.
It's going to get a patent also.
Yeah.
Yeah, it just never ends. But this probiotic, I think, is one of the best. So Dr. Prasad chose heat resistant and acid resistant strains of bacteria,
Yeah,
and
this
the
is very
most
important. The difference
important
is
ones.
we have acid resistance probiotics, and because most of them, the beneficial thing like lactobacillus or bifido, which are beneficial bacteria, they get destroyed in acid pH.
That's
It
not
is
good.
very important to have that. Otherwise, by the time they go to their own home, lower colon, there are very few left. So
Yeah.
it's not as effective. Some value, maybe some effect, but not very much.
Yep. Understood. Completely understood. And the omega that you mentioned, it's not a direct benefit uh, to
Yeah,
uh,
yeah.
the
You know
cancer
why
itself.
omega-3 is so important for both brain function and the heart. And brain is very important because 40% of the fatty acid, because brain has a lot of membranous structure, and 40% of the fatty acid in the brain is DHA. And DHA, also omega-3, gets oxidized very quickly. And so if you have a high oxidative environment, like if you are growing older or you have a disease, that means you have a high oxidative environment, then omega-3 get oxidized. And when they get oxidized, they become dysfunctional. So fresh omega-3 will replace them, all the non-functional omega-3. Again, it is so simple. Once you know the
It's so
science
simple.
behind it, it is easy to suggest.
Uh, I think a lot of us are going to have to listen to what you said again and again and again. But we eventually get it, Dr. Prasad. We eventually get it, no question about it. And but pay attention, people. Pay
Yeah.
attention. Dr. Prasad, Professor Prasad, is making it very clear. Omega-3 is important. You want your brain right. You want your nervous system right. You want your cells and functioning properly. Your heart
Yeah.
functioning properly. Omega-3
Yeah.
is important. So the core four is the main components for
Yeah.
cancer survivors. And Dr. Prasad suggests make sure that you're completely cancer free for a period of time before you start the collagen, but you can always just
Right. That's the only thing, make sure that you, at least 3 years, you have not reoccurred the tumor.
yeah, no reoccurrence at all. You got the digestive boost that will help you with
Further
prostate,
improve your gut. Yeah.
yep, improving the gut. And for those who took chemo, you want to offset chemo brain a little bit. The brain
Yeah.
boost is
Yeah.
right there for you.
Yeah.
So that's the
Exactly.
way to go. And those who are dealing with poor sleep, Dr.
Yeah.
Prasad's Sleep Boost formula is perfect for cancer survivors. And if you
Because
have
they have
anxiety,
also cancer survivors sometimes might have anxiety, and CBD is right there.
there is a CBD.
It's very important for those people who have some kind of anxiety, depression. Even younger people could have anxiety and depression for variety of reasons.
Oh,
And
it's not stop now. You got all kinds of causes for anxiety today, Dr. Prasad.
yeah, and
So,
then the Zol and people recommend Prozac and Zoloft. They make some improvement, but it has toxicity, and CBD has no toxicity.
yeah.
That's the difference.
And someone asked a question just yesterday, was doing a VIP presentation with someone and told them what you mentioned about this, the CBD boost for depression, because it's a serotonin reuptake inhibitor.
Right, serotonin reuptake inhibitor
And most depression medicines are
is
serotonin
yeah,
reuptake
exactly like
inhibitors.
Prozac and Zoloft are inhibitor of serotonin reuptake.
So now you're talking about something that behaves on that level without any side effects whatsoever. So great for
Exactly.
anxiety, great for depression,
And
and
because there is
also
FDA approved for the job, so the doctor recommends it.
that is absolutely beautiful. We love it. We love it. Well, I put the word out to see if anyone had wanted to share their own personal cancer survival story with us live on the program now. So if you are here and you are a cancer survivor and you'd like to share your story, please raise your hand, and we'd like to hear from you. So no one responded when I put it in the chat there, so I'm just putting it out there now.
Yeah,
And
you want Gretchen?
we have Gretchen. Gretchen has a great cancer survivor story. So go ahead, Gretchen. Let's hear your story, please. And
Unfortunately, I can't put on my camera right now because I'm out
oh, you're
taking
out.
care of something. Yes.
Okay, okay. We'll take you as you are.
Okay. Well, with me, I had an aggressive cancer, breast cancer. And so before I found out about micronutrients, I did a double mastectomy. And then I was about to start my radiation. I chose not to do the chemo because she only gave me a 10% number as it being beneficial for me. So I, at that particular time, I was learning about the micronutrients, and I went on and put my faith in that. So then I started taking them the therapeutic dose while I was doing my radiation treatment. And I didn't have any of the side effects, like the burning in the hand, the mouth, or the bottom of the feet. And then when the peeling happened, because they did tell us that your skin would peel away. And when that happened, my skin was completely healed underneath,
Hmm.
because they told me that it's going to be hard to put on a shirt and all of that. And I didn't experience any of that. And then I had diverticulitis during the time that I was doing the radiation. So I had to be rushed to the hospital. And I told Dr. Prasad about it. That was in 23. And he suggested the digestive boost. And so I started doing that as well with the therapeutic dose of the EMF with my probiotic. And at the time, I was only taking one probiotic. and but anyway, when I started with the digestive boost, I couldn't believe it. It was like within maybe a week to a week and a half, and the doctors were checking me out. They couldn't find it. It had
Hmm.
completely cleared up. And so I
Hold on. You
continued.
said you no longer tested for diverticulitis?
Correct. And I was really excited because I'm not a person for pain. So when when I had that situation happen, I continued taking my digestive boost, and my therapeutic doses, and at the last dose of my radiation, 2 days later, I had so much energy that I went on a cruise in the Mediterranean. So I knew that it was helping me, but I didn't understand at that time because I was new to it. But I saw the difference in my health and in my life. And so I stuck with it. And one thing that I did incorrectly was that I went to the maintenance dose, and I was told that was incorrect. And when I found that out, I went back to the chronic dose, and I would add additional micronutrients if I felt a little weak or something like that. And I continued on the chronic dose for maybe 3 or 4 more months. And then I just kind of peeled back a little bit and tweaked it to what I felt I needed. And now it's like my numbers were horrible in the beginning. After I had finished the radiation, your white blood cells go through the roof, and the red blood cells was so low. But then being consistent and going, I continued the chronic dose. And when I went back to have my bone density test, they had previously told me that I had osteoporosis, like the beginning of it. When I went back for my bone density test, they said I had no signs of osteoporosis and that all of my numbers were normal. And I showed them to Deborah. That's who introduced me to micronutrients. And she was like, "Oh wow, yes, all your numbers are great." So I've just been really excited, and my whole heart has been around sharing this with everybody because I'm like, this was a blessing for me, and I'm gonna definitely lay that blessing on somebody else.
Well, thank you very much, Gretchen. I only have the one complaint that I'm hearing this for the first time now, but that's okay. I understand. That's amazing. That Dr. Prasad, I never even thought that the diverticulitis could be a consequence of cancer
No,
treatment.
I don't. But see, healthy, once you make gut healthy, they get rid of all those bad stuff. I
That's
don't know because I would have never predicted it.
no, that's just unbelievable. So here's a cancer survivor relating their story that included all kinds of consequences that came from it. Now, I did have one woman down in Trinidad who only heard about you long after she had a double mastectomy. She had massive amounts of scar tissue, which sounds like what Gretchen was able to avoid. She said the pain was excruciating. Her niece here in the States sent her your formula, and she sent me a audio recording. I wish I had been ready to play it for you today. But she said she could not believe. She feels like your product cured her because the scar tissue completely cleared up, and she had more range of motion and got her life back, all because of taking your formula. So same thing Gretchen basically just said she was able to completely avoid. I don't know, Dr. Prasad. This is pretty remarkable. Just amazing. So Gretchen, thank you very much for sharing your story. We have time for one more. If somebody wants to slip in another cancer survivor Bible story, we told you all last week that we wanted everyone who was a survivor to be able to share their story. So Kathy Howard.
Kathy Howard.
Just a moment. Okay, hi, can you hear me?
Yes, we can hear you. We can't see you, but we can hear you. Go ahead, please.
All right.
Oh, she's on. Okay, very
Can you
good.
see me? Okay, hi. This is actually my husband's here with me. He wanted to share his testimony.
Okay.
Yeah,
And
my
your
name
name,
is
sir.
good. My name is Pastor Tony. How are you?
Nice to meet you.
Good, good. Dr. Prasad, I just wanted to tell this testimony and then give the reason why I'm doing it. 10 years ago, I was diagnosed with prostate cancer. At the time, I was sitting in the office. God said to me, no chemo, no surgery, no radiation. So for 10 years, I did natural treatment, coffee enemas, modified citrus pectin, other things. Long story short, 10 years later, I was going to Arizona for a treatment called Tulsa Pro. And while I was on the MRI table and then had a cystoscopy done afterwards, the MRI stated that clinically significant cancer is no longer present. My doctor was at UCLA University, their hospital in UCLA, and they did the overread and they came back and said the same thing. But the reason why I'm standing here cancer-free, I heard the testimony yesterday. My wife was listening to all of the testimonials and the product, and I had just prayed and asked God, is there a product on the market, something that's natural that I know that can work and give me the confirmation? And when I heard the testimonies, I said I had to come on, because even though I'm cancer-free, I believe in my spirit that what you have done and what God has given you can help me to maintain my health going forward. And so I'm excited. I'm going to purchase the product, knowing that even though I'm cancer-free, but there's something that God has blessed us to have that we can continue to go forward. And I'm going to tell this testimony, your testimonial, and the testimony of all of the people everywhere I go. And I heartfelt, I thank God for you, because oftentimes we trust in modern medicine, and we put that trust in modern medicine over God. And I thank God for speaking to you and the brother with the platform. God bless every one of you.
Thank you.
Thank you very much for sharing your story. That is absolutely wow, incredible. So, Dr. Prasad, there's another one.
Yeah.
What do you have to say for yourself, sir?
Jonathan, can you sometime give me a call?
I certainly will.
Yeah,
I certainly will. Quite incredible, and we're left speechless. We're left speechless. So, but thank you very much, and we're excited to hear that. And
there's Ed, another one, Ed.
Ed and Joyce Howard. You've got the last word here.
Yeah.
Okay. Yeah. I wasn't planning on getting on. Hi, Dr. Prasad and Jonathan and everybody on the call. Actually, I just wanted to mention a friend of ours that had brain cancer. He had an operation on the brain, and they had chemotherapy, radiation. Anyway, the cancer was coming back, and he really didn't want another operation. And it was the time I was hearing about you all, and was studying with you for about 6 months. Anyway, so we helped him to get on the 3 times the dose with 1 probiotic per day and a brain boost, and managed to get it down to him. He was in an isolated area of Bolivia. So anyway, it was from July 15th through till October 15th. And after about 3 weeks, most all of his symptoms had disappeared, except for his fingers were very, very swollen. And it looked like type end of life type of thing. So in any event, after a couple of months, those swelling went down, and he became somewhat normal. His headaches came back a little bit before they were unsupportable, according to him. And back in October, we talked, Dr. Prasad, you remember that? And you said, well, he's going to have to go to 4 times the dose of micro daily hydro. So we got him on 4 times the dose all of November, micro daily hydro, and 1 probiotic every day, and a brain boost morning and evening. And by the end of November, he didn't have the money for the tests, but we thought from the theory that it was going to be dead, because it starves the cancer cells and it stops the glutamine, the building blocks for the division of the cancer cells. So he stopped and the high dose, and he still has no adverse symptoms. It's been since end of November 23. and he's perfectly fine.
What kind of brain cancer he has?
It was hypothalamus, the gland right in the center of the brain. And you had said you needed to up the dose to 4 times the dose because it's right in the center of the brain. And a master gland, it was very difficult to get the high concentrations in there. So anyway, it's good news because he's continuing without any symptoms and
26,
happy.
28 now.
26, he's 28 now. So just wanted to let you know that update. Good news for my buddy.
Thank you. Thank you.
Wow. Thank you
Thank
so
you.
much. So much.
Brain cancer is difficult to treat because of you have to go through brain barrier, and then that's why, I suggested the hydroform.
Well, it worked. It worked.
So
Wow, that's just absolutely remarkable. Thank you.
And he's completely devoted to the cause, and he has all kinds of experience with all kinds of diseases, including cancer.
Wow.
Okay. Well, thank you.
Incredible. Absolutely incredible. Well, thank you very much again. Well, Dr. Prasad, it's pretty amazing. I'm just going to let everybody know how to get access to the products, get back with the person who invited you. But here's the cost of the Core 4. If this is what you're looking for from a cancer survivor perspective, the retail cost will be $310. If you were to buy it as a distributor or an affiliate like I am, it would be about $250. But for anyone who sets up a subscription, Engage Global is subsidizing your health and well-being. It's less than $200, or it might be right at $200 now, maybe a little more. I think there was a slight price increase recently. As a very minimum, Dr. Prasad has recommended the basic bundle, and that's the Micro Daily and the Probiotic Boost at the very least. So this is the bottom line that you would want to go with. But again, you can talk with the person that invited you to this discussion. They will help you to figure out which bundle is best for you. If you are taking higher doses of it, starting, let's say, with the basic bundle, then you could add on more bottles of Micro Daily to that. So you can add on more bottles of Micro Daily or any of the other components to that if you were taking higher doses of Micro Daily for whatever your situation is. But again, talk to the person who invited you, and they will be able to help you to figure out what is the best combination for you. And then just one final word, we always recommend, please don't expect a pill, potion, or lotion to do for you what you could do for yourself. Change your relationship with your couch. Get moving. We highly recommend that you make adjustments. Remember the preventable causes of cancer. There are preventions for recurrence as well. Take action to do something and take charge of your personal health and your life. And we applaud you and commend you all for what you've done, and congratulate all of you who have been cancer survivors. That's no small feat, and we understand that. Well, Dr. Prasad, thank you very much, sir, for all that you have shared with us and all that you brought to the table. As you can see, there are many people who are excited, and they credit their very existence and their wellness to your knowledge and what you've brought to the table, including many of the things that you've done as a gift to humanity. So thank you very much, sir. Folks, have a good day, and we will be talking with you again, and we'll see you next week for very incredible programs. All right, so thank you, Dr. Prasad.
Thank you.
Thank you, everybody, for joining us.
Dr. Prasad.
Thank
Thank
you.
you, Dr.
Have a
Prasad.
great day.
Jonathan.
Thank you. Great call.
Thank you. God bless.
Thank you.
Bye. Thank you,
Dr. Prasad.
Thanks for sharing.
Bye, everybody.
Thanks both of you.